From Colorado's news leaders, this is 9 News.
At a time when the state is already struggling to get Medicaid payments to doctors, we learned just this last week there's $210 million gone from the state budget because the U.S. Senate rejected a stimulus spending plan. 9 News reporter Aristea Brady takes us to a clinic in Denver where that situation is now having a very real impact.
Short on money, the Colorado State Legislature has declared a fiscal emergency.
Right now, Governor Ritter is getting the state's credit card out, essentially, to get us through the rest of this budget year.
The state decided to delay payments to the doctors and clinics that take care of Colorado's neediest patients.
You're fine.
At the Rocky Mountain Youth Clinic, 75% of patients are on Medicaid.
We're 75% to the tune of about $50,000 a week. We're getting in, needed reimbursement to keep the lights on and keep the practice going, basically.
Physicians treating patients on Medicaid
He looks good. I'm glad he looks so good.
will not receive their normally scheduled payments for the next 3 weeks.
Our biggest funder for us, is going to basically not pay us for what we've done for that 3-week period.
Although they will get paid eventually, in the meantime, they're having to go into their rainy day fund to foot the daily bills.
We have enough to get us through an emergency like this, but if a second problem came along, it could really hurt us.
And yet another big hit to doctors looking for Medicare payments came on Thursday. The U.S. Senate rejected legislation to provide stimulus spending that would have given $24 billion in aid to cash-strapped state governments.
It is clearly one of the problems with a state that becomes beholden to the federal government's ability to print money.
The state of Colorado confirmed that $210 million of the stimulus money would have been sent to our state. In fact, the state planned their budget thinking that money was coming. The state, however, says they weren't planning on using the money until early 2011. This buys time for the state to figure out how to fill the hole.
Really, the time that the money would become real problematic for us would be in the early part of next year. And so functionally, we've got a few months we can wait.
Aristea Brady, 9 News.